Today we'll be discussing the general anatomy of bone. Bone is a hard connective tissue. As we all know that a human body has 206 bones. They are composed of both organic and inorganic tissue. The functions of bones we all know, they give shape and support to the body. They help in movement of the body, also known as the locomotion. They store calcium and vitamin D. They provide a protective barrier to various internal organs like the skull provides protection to brain and ribs provide protection to heart and lungs. The bones also have a hematopoietic tissue, that is they help in blood formation. The regional distribution of bones is that there is an axial skeleton and an appendicular skeleton. The axial skeleton is in the axis of the body, that is the head, the neck, and the trunk. The appendicular bones are the bones of the upper limb and the lower limb. Now we'll discuss briefly the general features of bones. In this picture, we can see this is the head of femur. So head or caput is the projection that is on the end of a long bone. For example, the head of femur or head of humerus. Next is a facet. What is a facet? Facet is that surface which takes part in formation of a joint. For example, it is an articular surface and it helps in making the joint. Next is a trochlea. What is a trochlea? Trochlea is a pulley-like structure and it is also taking part in formation of a joint. So this is the lower end of the humerus and this is trochlea of the humerus. Now condyle. What is a condyle? The lower end of a long bone has two globular projections that are the condyles, the medial condyle and the lateral condyle. Now fossa. Fossa is a depression, is a hollow. This is the coronoid fossa and the example is the coronoid fossa of the humerus. Groove is an elongated fossa. I mean fossa is a circular hollow and groove is an elongated hollow. This is on the upper end of the humerus. Now what is a notch? Notch is a structure that is an inward bend in a bone. For example, this is a hip bone and this is the greater sciatic notch. Hiatus is an inverted U-shaped structure. This is sacrum and here the arrow shows a sacral hiatus. This is an inverted U-shaped structure. Now fovea is a small pit or depression. This is head of the femur and this small pit is called the fovea on the head of the femur. Process is a structure that is protruding from a bone. This pointed structure is the styloid process of the temporal bone. Spine is a sharp structure of a bone. This is the ischial spine. The hip bone has three parts, the ilium, ischium and pubis, and this is the ischial spine. Ramus is a broad bar of bone. This bone is mandible and this green part of the mandible is called the ramus. It is a broad bar of bone. Now, humulus is a horn-like structure. This is the hyoid bone, and this horn-like structure is called the humulus. Line is a structure that is a marking on the bone, and various muscles are attached. This is the pectineal line on the shaft of the femur. Now, tuberosity is a protuberant structure. For example, this is ischium and this is the ischial tuberosity. This is the part where we all sit. Now, tubercle is another protruding structure on which muscles are attached. This is the adductor tubercle on which the adductor magnus muscle is attached. Ridge is a sharp line on the side of a long bone. For example, this is the medial supracondylar ridge. This is the medial condyle, epicondyle of the humerus, and this is lateral epicondyle of the humerus, and the condyle continues upwards as the supracondylar ridge. Now, crest is a relatively more thicker line. For example, this is the iliac crest of the hip bone. Lips are demarcating structures of a crest. For example, this is the iliac crest. It has an outer lip and an inner lip. Epicondyle is a small condyle on the top of a condyle. So I previously told you the medial condyle and the lateral condyle. Just above the medial condyle is a medial epicondyle and just above the lateral condyle is the lateral epicondyle. Malleolus. What is a malleolus? At the ankle joint, we can see a lateral malleolus formed by the fibula and a medial malleolus that is formed by the lower end of the tibia. Foramen is a circular is a hole. Foramen is a hole for the passage of various structures. Maybe it may be a vessel or a nerve. Canal is an elongated. The foramen is a circular hollow, and the canal is an elongated hollow. Meatus is an opening. For example, this is external ear, middle ear, internal ear, and the opening from the external towards the internal, this is the meatus. This is external auditory meatus, the opening. Now we will discuss the classification of bones developmentally. So developmentally, bones may be membranous, they may be cartilaginous, or they may be membranocartilaginous. The membranous development of the bones is such that a mesenchyme transforms, undergoes ossification, and the bone is formed. Mesenchyme, we all know, is a connective tissue in the embryo. It undergoes ossification and leads to the formation of a bone. Example is the bones of the cranial vault, the parietal bone, the temporal bone, the occipital bone. These are the bones of the vault and they have membranous ossification. Next is the cartilaginous